Hello, hello, hello. Happy Saturday. Going towards the end of the month. We had a couple of weeks to see each other, so let's get started. Hope you're all well. We're going to start our day today with reporting. Now, those of you who have already been with me in the technician course, we did a reporting basis. The importance of reporting there's First of all, we are required as professionals to have proper reporting and to keep our reportings in our office. Okay. But when your client also sees that you keep proper reporting, it builds the trust of them to you. Okay. It builds transparency, it builds clarity. Okay, because they know that you track their progress, and it's very important. Throughout the years that I have been working, my clients, many times, they come back after a couple of sessions and they say, well, remember when I first came, how was I compared to now? Or they may, a few days may pass by, did you see this or that? So obviously, it's very important to have proper reporting. Now, in our technician course, we have learned there's some noise. What noise? Do you still hear noise? Maybe it was my chair moving. Do you still hear noise? Now that everything's quiet, is there still noise? Maybe I have to do something else technically. I think because while I was talking, my chair was rubbing the desk, and maybe it was making noise. Ah, really? The thing is, technically, I don't know what to do. Do you know what I should do? Because my microphone is built in my laptop, so I don't know. Do you all hear? Do you all hear the noise, or only Kevin hears the noise? Christina, you hear the noise too? Oh boy. I don't know what happened. Buzzing. Let me see, one moment. The truth being said, there's some tech guys here And maybe some of my cables in the back have been, you know what I'm going to do? I'm going to put this one, and maybe this will work better for you guys. Hold on. We'll find it. How's this? Is this better? Okay, so this is better? Great. We got it. Thank you. I thank you. Okay, so going back to the thank you. Thank you for all. Thank you, Kevin. Thank you, Christina. Thank you, Madalena. Thank you, everybody. So, going back to the importance of reporting. As I said in the technician course, and those of you who were in my technician course, you've learned how to do the print screens, you've learned how to do the simplicity report, which are fantastic ways. And I still use, even though the report I'm going to be showing you today, I still use print screens, because print screens shows a little bit more of what I'm going to be showing you today, but there's the pros and the cons. It's the what are the pros? The pros in the print screens that I've shown you in the technician course. Just for those of you who don't know, in the technician course, the assignment in the technician course is to do the print screens, right? So the print screens are really important because it gives you your reporting, right? And it gives you the full view of your matrix and whatever graphs you have, et cetera, the risk panel, okay? And your filters that you use. The thing is that it takes a lot of memory, all right? And the thing is that you can't, how do you call it, save it on your laptop, because at some point your laptop will be full, right? And that's why I always say in the technician course that in order for you to be properly organized, you need to save all your documents on an external disk drive, all right? So that you don't load up your laptop, so that, in case you get a virus, in case, for the memory, and it just slows your laptop down in general. So an external disk drive is very important to have in your office, and so that you can be organized in that sense. Now, the report I'm going to be showing you today, though, may not have the graphs, but it has all the information of the matrix and some more stuff. And it's built in your software. All right, so it doesn't take up a lot of memory. So that's the good thing. And whenever you go into your software, you have it. But the thing is that the con of that is, safe. You want to go into your client's report without going into the program. You have to go into the program to be able to receive the report. Okay, so this report, you need to go into the program. So let me just show you. Let me show you how this works. So okay, let me put myself on. For simplicity reasons, I didn't have anyone tell me who who they want. They may want. Let me load another picture of myself. look at this one. Okay, so, and let's calibrate. We need to do a testing to get in. Let's load my pictures, an older picture. And it was 2 years, 2 years ago. Okay, so as I said, reporting is very important for you to organize your office properly. It gives you accountability. It gives you transparency with your clients. It builds trust so that they know that you're organized, okay, and you're accountable for what you're doing with them. You can also, detect problems early by keeping proper reports and by studying them better. Okay. It gives you a way of communicating with your client. A lot of my clients like having their reports because some of my clients go to psychologists as well and other therapists, and they discuss their reports with their other therapists, even with their doctor. So it helps also the communication with their other therapies. And so it builds a bridge, okay, what you're doing. So let's keep on going. The thing is that some of the panels it's good to print screen. Like for instance, the calibration and the information that came up here with let me do it one more time. The information that came up with the geopathic stress cannot be loaded in the report that I'm going to be showing you now. Only certain panels can be loaded. Everything from the matrix can be loaded, and anywhere that it says load report, right? So any other panel that does not have load report, like for instance, the calibration, cannot be loaded there. So some panels still you need to print screen. So having both open, let me open a Word document. For print screens, you need a Word document. Okay, so like for instance, you don't have load report anywhere. So the only thing that you can do here is print screen if you do want to have the information here from the geopathic stress. Okay, some water cross detected for me, lay cross. Okay, but all the other geopathic stresses are good. So water cross gives me the indication that some humidity, some water lines may influence me. Usually that has to do with humidity. Okay, there is humidity where I am right now, so that's why. All right, so let's go close. You want to close. Before I close, I print screen and I load it here. All right, and let's go yes, and let's go into testing. So let's test. And prepare. So depending on the laws of the country that you're in, usually a therapist needs to keep their reports 7 to 10 years. Okay, it depends on the jurisdiction and the laws in the local country that you're in. So you have to see that. I know here in Greece it's 10 years. Okay, so for counseling, for instance, counseling usually it's 7 years. Okay, but you do need to you need to protect your records because there's also the thing of confidentiality. Records should not be open, they should be locked somewhere so that even potential employees in your office don't have open access, you know, or maybe other clientele open access to your records. Okay, they should be somewhere locked. If you have printed records, or if they're somewhere on a hard disk, they should be locked somewhere with a password, for instance, for you only, for your eyes only. All right. So, what this is every time I have mentioned until now in the technician course and up till now in the specialist course, we have this little blue box. And I've always said that the little blue box has many functions. One of its functions is the piggyback that it has. The little blue box works as a piggyback because we're loading things in there, and it's piggybacking all therapies that you're loading in there, any kind of remedies, etc. But another function is the reporting, because anything that you load in the little blue box is used as a report. And I'll show you how. First of the basic report that is loaded in your little blue box is your VARHOPE and your demographic and some not the demographics. You can load the demographics, but your VARHOPE is loaded. So it starts with your name, right? The today's date and time. Okay. And it has here from environmental, physical, mental, social, spiritual, what's more stressed. For me, it's more physical. I'm good in general. Gender. Okay, there's a major obstruction to the healing process. Please expect one treatment for result. Now, one treatment means that within one treatment, I'll feel better. I've had some of my students tell me that, oh, this says sometimes 2, and it always says 2. Why doesn't it change? Or some people have 3. Why doesn't it change? Well, it won't change if your SOC doesn't change. That's one thing. And if your lifestyle habits, or if the device sees that you're not doing certain things that it should. For me, it says 1 because within one therapy, I feel better. All right. People who have more than 1 means that they need more than 1, and it'll always stay there if they don't do certain changes. And what I explain to people is it would be great if we could just press a button and we're well, but it's not like that, because it's a combination of things. It's not only our device that's doing therapy. It's only 50% of the therapy. The therapy that we're doing on them is only 50%. The other 50% is their lifestyle. And it's the information that's given from our software and from the quantum field. It's the information that we're getting that will help them with the other 50%, but they need to listen to it. A lot of people don't listen, unfortunately. A lot of people do listen because that's why they come here, but I also have people that just don't want to listen. They want to do what they want to do, and they want me to just press a button, and it just doesn't work that way. Of course, they are better than when they came, but they could be a lot better, right? So anyhow, that's another information that's in your little blue box. We have the body fat estimation. We can get that information. Then we have the volts, ampere, resistance, the Varhope information, your numbers from the Varhope. All right. We have the last visit as well. Okay. So we have this information. What else can be loaded? We go here under the reporting, and under the simplicity report, the simplicity report I've already showed you in the technician course. We have this list of items here that you can add information in your little blue box. Let's go one by one. Add AccuFive system. That gives the 5 acupuncture, main acupuncture meridian systems. Okay, and which one is most stressed? For me is my liver and my kidney meridian. Okay, so that's information, but it's loaded here. I can go to the next one, add body fat and risk profile. Now, if I think, okay, report loaded. Yeah. Yeah, the risk profile that comes up is the explore risk of. These are the risk. That is also added here. So body fat is 33%. Right now. One moment, let me show you something. So, because I always say I'm 60, but I'm 60 at the end of the year. I'm 59 and a half. All right. So 59 and a half. At 59 and a half, I should be between 23 and 35%. So I'm at 33%. All right. So it's on the high end, but I am getting lower, which is good. And so this is giving me an indication that I'm on a good road. Used to be higher, now I'm better. Ideally, I think I should be around 28, 30%. So I'm close to that. But so this gives you that measurement here, energy management, reactivity, metabolic, and the other numbers from the Varhope. All right, let's go to the next one. Hyperreactant report. So from the hyperreactant report, the highest risk for me is at 115 for gluten and for allergies. Now, I do not eat gluten. I try not to eat gluten. Sometimes I do, though. I try. So it's good to say, okay, I don't, but sometimes it's in front of me. Okay, so I think yesterday and the day before I had some gluten, and that's why it's coming up. Okay, in general, I have it really low. I try to avoid it. But the device always catches you. Okay. the first thing that came out of my mind, but I don't eat gluten. Yeah, but I had gluten the last 2 days. And that's always say when someone says, but I don't do this, say, well, for some reason, this is coming up. This always happens, right? And I tell them, well, for some reason, this is coming up. I don't leave it because they say no, right? I say, for some reason, the device is coming up. And after a couple of minutes, they say, yeah, well, the truth is, and then they start remembering. Okay, so believe in what the device is saying. Excuse me. Believe in what the device is saying and insist. Okay, because when I say, well, for some reason this is coming up, they start thinking, and it usually does. 99.9%, then they come up and say, oh yeah, the truth is that lately, da, 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 da. Okay. There may be room for some mistake or error, room for error. But I don't think it's error. I think it's also the energetic field. Because I've had people say, well, I don't, but my spouse does. Okay, so the energetic field of the spouse comes on to you. It happens. All right, so we'll see. What else is coming up for options for episodes? Okay. So I was at a wedding right now. It was an early Saturday wedding, and we had wine and stuff like that. I usually don't drink, but yeah, that's why I'm yawning. Okay, so let's go to ISOD and NOSOD. Simple functional prescribing. Interesting. So NOSOD concerns simple functional prescribing. So that's not of concern. That's okay. Concern lymphogranulomatosis and iatrogenic disease. Yes, because in the past, I've had a lot of medication. Okay, so that can be the side effects from the past. Also concern erythemas, warts, keratosis. All right, so yeah, I do have a tendency there. Okay, some phlegmona, carbuncles, acute inflammation of connective tissue, Sioux or pork toxins. I don't, no. This is interesting. I don't eat pork, but I do take collagen that has pork. There's a question mark there. Now, the thing is that it comes from pork, the collagen that I'm taking. The thing is that it's really good collagen, and I love it. And I've been taking it for the last couple of months. Maybe that's why it's coming up. Could be. Okay. But I'm not going to stop it because I feel really good with it. So what we do is just detox then the toxins. The other ones, myomas, prostate cyst, ovarian cyst, toxins from solvents. Okay. So that's that information gives you, these reports give you a lot of information. Add SOC to report. You can add the SOC so you remember. Let me see, add SOC. There it goes. All the SOC that I have put there so you can remember if anything has changed. So all this is good information for your reporting. Add Vindicate. If you've added information to Vindicate, you can do it from here. So let's see. I don't remember if I put anything in it. Yeah, I haven't. Everything's 0. You see? in the vindicate. All right, let's go further down. Now, if you add top 200 items, the top 200 are actually the low numbers. It's not the top, it's top considering it was on the top part. So the top 200 are actually the low 200 numbers, the lowest items up to 200 in number, okay? Add top 200, so that's the low 200 numbers, the low last 200 numbers, right? Add bottom 100 items, 100 remedies. So the bottom 100 remedies is all the bottom, that's the top numbers, right? Up to 100, not 100 in reactivity value, but 100 items. Okay. And whatever's over 90. Now let me give you, I'll just do it. Add top 200. Those are the low numbers. Look, all the 200 items of low numbers. All right. I'm going to add also the bottom 100 items. All right. So that's, see, 146 gripe here. It's a flu. So I'm about to get sick probably. Okay, that's the bottom numbers. And whatever's over 90. Now, what you can do is for the over 90s, let's choose a number here. Let's choose from the chromosome and load whatever's over 90 from the chromosome. So load here, these 5 items. Let's go here. Add value. That's over 90. There we go. All right, so whatever's over 90. Okay. Now, what else can you do here? From there on, you can, let's filter some items here, for instance. Let's go to disease. And earache. I don't have an earache, but my ear is kind of itchy. Maybe that's why. So I can load the earache there. Chronic fatigue, yeah. Sciatic nerve disorder, okay. And delayed reaction. So I could load these items. So you'll notice the reaction here. It says it here. Okay, these values are different values, giving us some kind of indication. Why would these values be different in the little blue box than the values after testing? There is a logic between that. So it's giving us the indication that even though these numbers are over 100 now, out of these 4 items, the highest is the chronic fatigue as an issue. More chronic issues are the earache and the tibial nerve disorder. That's more chronic. All right, so you can filter anything you want here and load it in the little blue box. Like say if I want to filter brain, for instance. Some dementia coming up. All right, so when you do this though, when you're just loading certain items, you don't getting the full picture. So in this sense, sometimes you would want to take a print screen. So in this case, what I would do is take your little print screen, and also for brain, let's say. All right, or ongo. Remember, these are the filters that I like to have. So So I'll do a print screen. Okay. If you do see an item that kind of makes you concerned, you can put it the over 90 here. Ability to accept praise. Interesting. All right. So what else can we load here? We can go to the reporting and causes and aggravations, which is a good one. And you'll notice save to report causes. Right, so we have karma here, trauma, and desire, stress. So if we save to report and report loaded, let's go back to the little blue box. Look here. Okay, so we have the now from aggravations. Aggravations. This is aggravations. One second, let's go to the aggravations and save to report. Okay, and if I close, okay, this is aggravations. The aggravations. Aggravations only loaded. Causes should also be loaded. Check in case, just in case my demo package has not been updated. That can be a reason. Because both causes and aggravations should be loaded. Now, we can go to Eductor 1 report or a nucleus report. Okay, and we can make the report here. All right, and it says certain things here, so we can add report to info file. Here we go, and it adds it. So if we close this one, here it is, the report. What's something else? We have then emotion and neurotransmitter chart. We have this one. So which ones are the highest numbers? The passivity, religious conflict, dominating, unaware, obsessive. Okay, thoughts over and over probably, or obsessive, I need to do things when I need to do things. It's true. All right, so emotions here and report, save to report, reports loaded. And we can also go to the neurotransmitters and do the same here. Let's do the same, save to report. So let's take a look at what happened. So we have all the neurotransmitters and we have all the numbers here in the emotions, right? We can, I'm not gonna, just give me a moment for the load chart maker. I'm gonna come back here. Let's go to a Sarko chart. Okay, Sarko chart. And we have all the Sarkos. What's the highest number? 20. All right, so We go to report, save to report, and it's loaded. So if we go here, here it is. Okay, so we have our start code. Now, let's do as if we're going into our normal therapy, right? We go to our short start code, right? And shortcut to RX, and we load. Now we can also add this information also to report. Anywhere you see add to report, it's loaded in your little blue box. So if I close here and I close here, it's loaded, right? Now if I go to the risk profile after that, and let's say I load here, your items, and we can go to the minerals, for instance, right? And we can load some item here, not obligatory, but if you want to do a therapy, and we can make report of above, so reports loaded. Remember, we also click on the make report of the minerals and amino acids for the simplicity report, right? But we can also add it in this report as well. And I'll show you. So minerals, if we go to the minerals, there we go. All the minerals are here. If we go to the amino acids and we have make report up above, and let's close, and there's the amino acids. Now, same works for the perverse energy. Make report of above. I'm not doing it for now. The aromatherapy. All these buttons have on the right side the make report, and it loads it in your little blue box. Okay, now I'll show you also the buttons for the nutrition and the dental, etc. But if we close here, all right, you can see this. You can see all these numbers. Now, if we go to the universal biofeedback therapy, which is your next panel, here there's no add to report. Okay, there's no add to report. So if you want to take a picture of anything here, you'd have to take a print screen. All right. So that's why I'm saying there's some certain panels that you still need to do the print screens if you want and if it's important enough for you. Otherwise, if not, just you leave it with the little blue box. Now, if you go here again, there are no add to reports. Right, so you can just do your therapy. There's no add to reports. If we go to the top requested therapies, if we go here to the auto frequency therapy, there's no add to report. Let's move forward and see in the other little panel that opens up. All right. So let's do it. So just to run it. And so there's no, if I go to the energetic here, there's no add to report. All right. So if you want to take a picture of this, because this is also important information, you need to take a picture of this. All right. So you do the therapy, you know how to do that. Let me just go through all of these here. Do we have any add to report? There's no add to report here. Anywhere there's an add to report will load there. If there's no button add to report, you'd need to take a picture. All right. The scalar, there's no add to report, right? The trivector, no add to report. How about in the DNA? No add to report. All right. So anywhere there's no add to report, you can't load it. It's for print screen. All right. So let's go into the spinal. Here we do have an add to report. So let me show you. If I do a test and treat, all right, and if I go make report of spinal program, you see this one? Report loaded. Let's see what happens. Let's close this and see. Yeah, it didn't. It just, last ones were from the risk profile. So that button doesn't work. The make report does not work. Let's go to the nutrition profile. If you make a master nutrition report, make master nutrition report. Let's go back to the little blue box. And there it is. Here is a master nutritional report. Okay, all nutritional report. Okay, so in nutrition, your button to add the report is the make master report. Remember, this report is for the simplicity report. This one is for the little blue box. Okay. Now, if you go into a specific, let's say I went into the vitamin A, right? It has make report loaded. Let's go back and see if the beta carotene, fish oil, retinol, etc. were added. There we go. Okay, so you can also make, apart from the master report, specific reports. If you go into each panel, let's go back there again. See what else we can do. Okay, so you can go into each one of these and get your report, make report. All right. The same for, let's say, the digestion. Let's go to the fat digestion. Again, make report, some fatty acid. It's coming up, lipase and cholesterol. Okay. Close, right? Now for these are AFE programs, so we don't have a load report for that. Stress and cortisol, we have the add report. Did I just say add report? Maybe I clicked on adrenal balance probably instead of make report. So we're stuck for 1 minute. Sorry about that. All right, so I can make report. Okay. I think there's a bug. I know. I think I have a bug. And if it's a bug, sometimes, when you see things like that happening, that I didn't press an AFE program and things like this are happening, it's a good idea for our tech guys to go in and look. Sometimes this happens when you have little bugs or garbage from Windows, okay, and it needs clearing up. And our tech guys know what to do there. Okay, so let's close here. So you get the idea. Whatever it says, make report, you make a report, and it loads into your little blue box. Now, let me see some other, let's say, panels that may have interest. As I said, the universal biofeedback therapies do not have, neither does a time therapy here. If you want to show which, let's say, therapy that the unconscious is asked for, like the flexibility, I would need to take a picture of that. So anywhere in the panels, if there's no make report, then you can't load it. You need to take a picture. Okay, so now that I've loaded a whole bunch of information, make sure that you have your basic information. Your basic information is from your matrix, from your risk, from the nutritional profile. Those are your basics, aggravations, etc. I mean, even if you go, let's go to homotoxicology as well. Let's see if there is a report there. Here, your little gray box. There's no place you can load the gray box, so good idea to take a picture. So, you combine both therapies. All right, so let's take that one out. And does it have load patient picture? No, add to info. Report. Let's load the report. No. No. So having said that, add to info. Yeah, so here we can't load the information. Like I said, so here you'd need to do the print screen. Now, say if it's in the next step. Let's do the stomach. All right, there's no load here. Let's continue to test. All right, so save below info to report. Let's see what information was given here. I need to close this to get that information in here. Yeah, so we can't get in any other information here. Whatever I loaded from the homotoxicology panel. And that's it. Let's go to the blood to see if we can load anything from the blood therapy. Not this one. The dark field, sorry. Yeah. Yeah, we can't load the information from here either. Let's see the blood treatments. There's no load therapies here. Recommended action, there's no load therapies here. Reports. So anywhere you see the load report, you can load the information to your little blue box. Let me go back here to the load chart maker reports. This is the report. This is another report maker apart from the one I'm going to show you now that we're building, because what we're doing with the little blue box is that we're building a report, and then it's going to be shown in a report. All right. This report maker here is yet another report maker. Okay. You understand how important reports are. Just the fact that our software is giving us the simplicity report. It's giving us the report from the little blue box that I'm going to be showing you to how to get it out. It's the report maker here, a third one, and the print screens. The importance of reporting is very, very important. All right. So front page, here's a report with the front page. This report maker, you can also do therapy here. You can either print it out, but you can also Here we can't do anything here. That's causes of disease. Causes of disease is yet another one involving cholesterol. So I need to be careful with my cholesterol, even though it is low. But because I had the weight before, I do need to be careful. Areas of greatest concern: EEG, acupuncture, and nerval energy, physical blockage, unhealed trauma, older, aggravated by smoking. I don't smoke. Why would something like this come up? It's because I do have an issue with my lungs. Not an issue, but a sensitivity. Ever since I was young, I used to have asthma. So if someone does smoke in front of me, it does bother me. I do get aggravated, right? Cause of disease, possible cause of disease, allergies. I always have allergies since I was young. All right, so it's something that I need to be careful of, my immune system. So again, we can print this. So these are reports that you can print. You can do a print screen of it. All right, acupuncture. Eductor 1, make the medicine report. Change from last visit. All right, and you can get additional information here. And again, you can print it. Chiropractic. Again, here we have blockage in. We can write information here. Nutrition. Okay, there's some information that's not, apparently they haven't finished with this. They started it and it just didn't finish. That's okay. I mean, they got it to some point. Chart causes is in a pie diagram and aggravation. All right. So that's information. Some things you can do therapy. You can print this out. Okay. It's a chart maker. Now, coming back to the little blue box. What do we do with this? This is information that, first off, we put in our little blue box. Remember what we do with our little blue box? It's piggyback. So whatever we've loaded there, even though we wanted it as information for your piggyback, we also have it for your report. So where do we go? We close here, all right? And in the main panel, we see report. You see this? It's an option called report. So we click on it and look what happens. Now, number of reports. I don't have any reports loaded as a history. All right. Diagnosis. First off, we need to make current examination report. So the current examination report, if we load that in, brings the little blue box here. This is the little blue box. All right, with the disclaimer and everything. We can write here, what's my main concern? Metabolic and hormones and weight. Okay. It's getting under control, but it's still there. All right. Save examination. So what happens is if I go to table 1, I see here my first record made. and I can click on this and I see it. All right, and I have it there. I click on click, it goes in table form, right? I could also click on this and print it. So it becomes a notepad under notepad, and I could print this, print, all right, and I print it for my clients. Or you can save it, you can save as and save this in your external disk drive with your print screens. All right, so you have all the information and you can do it's a great understanding of the matrix and the information that you have there, right? So say if you have a person, I mean, coming in and you've seen them 10 times, you can have as many reports here, and then you can easily just go here, from testing, you're here and they ask you something. What happened the last time or 5 times ago or that date there? Or you can easily also see, well, you've come to me 5 times because you see 5 reports, right? So you're organized. Where's the report? Report here. So you're organized. You see how many reports a person has. You can go and refer back to them. How were they now? How were they 5 sessions ago? How were they 10 sessions ago? Now, say if you're here and you want to go in and you want to modify report, how would you want to modify? You would sometimes you see some things in the matrix that you cannot take a picture of, or you cannot load it. You take a picture of it, but you can't load it. But you want it here, you can write it. All right, you can write whatever you want, and it's saved. You can say main concern, headaches. Okay, so you can have that information there too, and you can save examination. All right, so really, really important. Okay. If you start working with these, you'll soon get the hang of it, and they're very useful tools. And these tools, remember, create your professionalism in your office. Your client, even if they don't say anything, they are looking at you. And they are watching you, and they have their opinions. So it's best to do everything right, and so they can respect you as their therapist. Okay, reporting is very, very important. Okay, now, having said that, I don't have anything else to say about the reporting. That was basically it. And as I said, anywhere that you can see, make report of, it's loaded in your little blue box, then it's there. It can be loaded in this report. Otherwise, if there's no button to load to report, you print screen it. All right. So having said that, this topic was always shorter than 2 hours. 2 hours is not needed because it's basically very easy. All right, and it's very, very important. Now, the next topic that we have is addiction therapy. Now, the addiction therapy and the smoking takes a while. So my suggestion is we take our half-hour break now. It's 5:15. All right. We take our half hour now. So, and we will, instead of a 2 hour, it'll be 3 hour. Because we still we finish at 8:30, but we do need that amount of time to cover addiction and the smoking. Okay, because it's a huge topic. Okay, so let's take our break now. Half hour. We'll be together at 5:45 Athens time. It's 5:15 right now. 5:45. We'll be together. Okay. See you in half an hour. Hello, hello, we're back. So let's dive deep into addictions now. Um, Addictions is a big, it's a huge topic. I mean, when we're talking about addictions, we can be talking about addictions to thoughts, obsessive behavior. We can be talking addictions, to substances, to smoking, alcohol, even food, overeating, addictions to way of life. So when we're talking about addictions, we have to differentiate and see what the root cause is. Now, there can be one root cause, or there can be plenty, a variety, a combination. Definitely, hereditary factors play a role, but not only. Environment plays a role, trauma, childhood trauma, neglect, mental, any kind of mental disorder, anxiety, ADHD, issues definitely have a predisposition towards addictive behavior. Um, Even, a shock, things that happen in your environment may trigger these tendencies. Mm, Other type of, let's say, early on things that can trigger addictions, peer pressure for children. That's a big thing that parents need to have their antennas on. Peer pressure, mm, any kind of social media definitely, pictures often saying curiosity, desire for to be people to be children to be liked, being popular. Okay, another thing, so a low self-esteem can also trigger teen drug abuse, let's say, or substance abuse. um, so what we're going to do here today is, though, the anti-smoking protocol. Now, there is a specific protocol that I use that over the years I have found is the best way to address uh, the anti-smoking, and help a person stop smoking. But the thing is that a person must also want to stop smoking, because remember, one of the questions that we always ask in the SOC is, how responsible are you in your life? Right? So a person has to have responsibility of what they do, because you as a therapist are there to help them. They have to understand this, and you have to explain this to them. You are there to help them. The device is there to help them, but they are responsible if they take that cigarette, okay, or if they take that substance. They are responsible. You are not the device, or you are not responsible if they take it. Okay, they are responsible. So This is something that I always make clear because I have heard that in the past when I first started, ah, I started smoking again. As if I was, well, yeah, yeah. So, I always make it clear. And, if you make things clear and there's clarity in your agreement for the cessation to smoke, then they know that they are responsible. All right. And they can't come back to you and say, you didn't stop me from smoking. Okay. You have to be very clear. Okay. So first off, they have to want to stop smoking. Two, they have to know that they are responsible. All right. Now, how the cessation protocol works, and this is tested and is actually the best way to stop. It's a 5-day program that they have to come every day if they want this to succeed. And if they need to cut the smoking immediately. Okay. It's a 5-day program. All right. That they come in every day. If a person calls me and I don't know them and they say, I want to start smoking, then they have to come in the first time and then we set out a plan. I do their first session and I have to see if they are ready, because some people say they want to smoke, but they want to stop smoking, but they're not ready. Okay, if there's a lot of things on their table, all right, that need to be settled first before they stop smoking, their daily lifestyle, all right. But of course, there's no set protocol. Everybody is unique. I've had people that actually I thought were not ready and they actually did it. And they still don't smoke. And I see them after 15 years and they said, you stopped me from smoking. And I said, they did it. They did it. And inside me, I said, how did they do it? Because I truly believe that they weren't ready because they had too much on their table. All right. But what I usually do is I first want to see them. I do a first session. Then I charge regularly. It's not in the package. Okay. And I prepare them, though, for their cessation. And what do I mean by prepare? First of all, if a person comes to me, I do a normal therapy. I want to see how they are. Like if I see heart issues like this here, heart, or any kind of issues, I prepare them. And I also go, one of the things that you need to go is into the nutrition. All right, into the nutrition profile in order for them to be prepared. And you need to see what vitamins they need. Okay, now, right now, okay, probably because I'm about to get sick. This is what it says. I don't feel it, but the device knows 3 days beforehand if you're about to get sick. And right now it's telling me I'm about to get sick and I need all these vitamins. This is normally not the case for me because I take a lot of vitamins, but probably, truth being said, is that these past few days I have overworked myself and maybe something is coming down on me. And that's why all this is coming up. All right. So what I see is a person that needs vitamin therapy. So in order to first start and help a person stop smoking is you need to give them mega vitamin therapy. If they have been smoking for like over 10 years or 20 years or 15 years or even 30 years, by taking out the smoking, that dopamine level is really going to fall. And that's the reason why they're addicted to smoking, is because they have They have learned that reward process. When smoking, they get the reward signal in their brain, and their dopamine goes up and they feel better immediately. And they have trained their body for so many years for this to happen. And if they take that out, their dopamine level is really going to fall. And they're going to be looking for ways to cover it. And that's why usually people gain weight, start eating more, their dopamine level goes down, they start doing other things, all right, and they start gaining weight, all right. So one thing that's very important, first off, is to keep the dopamine level high. And one way to keep the level high, one way, is megavitamin therapy. So we need megavitamin therapy, all right? And, at least 1 week before we start with the protocol, that we need for them to start with their megavitamin therapy. Now, one thing that I tell them, because a lot of people say, well, why do I don't need it? I don't need to, some people say that. I don't need to take vitamins. But here's what you're going to tell them. Each vitamin, each cigarette that you take and you smoke, each cigarette takes 30 milligrams of vitamin C. I'm just giving you an example of one vitamin that it takes from your storage. 30 milligrams of vitamin C each cigarette. So if a person is smoking a pack of cigarettes, that's like 20 cigarettes, 20 times 30, right? Is 600. 600 milligrams of vitamin C that they need more than me, that I take 1,000 milligrams of vitamin C either way. So what have they done to their body? They have, in fact, taken all that storage of vitamins from their body. And the dopamine that they're doing is covering up the problems. So what could happen is by taking away the cigarettes, may even trigger another autoimmune issue if it's not already there. It may not trigger it, but it'll come up to the surface because it's already there. All right. The problem is smoking is a huge problem. First off, it covers up a lot of problems the first few years. Okay, because you have that dopamine rush and you don't feel it. But then sickness, 10 years of bad habits, you start getting the problems out, right? After 10 years of doing bad habits. So one thing is the megavitamin therapy as a preparation. Okay, so for my thing, a multivitamin is definite. So I would take 2. When we're talking about megavitamin therapy, we need at least 2 multivitamins. I need omega-3, definitely. I need vitamin D. I need extra B complex and vitamin C. Like I need multivitamin plus the extra others as a combination. Mega vitamin therapy. All right. That's 1. 2. We want to see some other things. What's coming up? Like where's depression in the matrix? Okay. Where's depression? Because by taking the cigarette out of a person that has depressive tendencies, they may need a couple of therapies before you do this on them. All right. So the cessation. So let's take a look. Intolerance, criticism, wild ode to satisfaction. All right. No. Depressive isn't there. Let's go to emotions. Stress. All right. front to back, aggression resentment. Okay, so I don't see depression there, but let's take a look where that might be. So, some related issues with hormone issues are coming up, but not depression as depression. Hormone issues are coming up, which is logical for me. Okay, but not depression as depression. So if a person does have depressive tendencies, you would say, look, I would prefer if we do the anti-smoking, let's say in 2 or 3 months, get you prepared, start your mega vitamin therapy. Let's do 2 or 3 sessions first and then decide. All right. And in the meantime, why don't you start doing your favorite cigarettes? The favorite cigarettes usually don't surpass 8 cigarettes a day. All right. So that's, if I see a tendency for these things, so we can have good results, because what your focus is you want the best result, and they're coming to you for your expert device. You don't say, yeah, I'll cut your smoking. Okay, everybody's different, and you have to analyze what's going on here. Okay. For me, if I was smoking, yeah, no problem. I could go directly in after a week, after I start my mega vitamin therapy, into the cessation program that I'll explain in just a moment. But for a person that you see depressive tendencies, that maybe are taking antidepressants, or unless a doctor has told them, look, you have to stop smoking now because the issue of your heart, the issue of cancer risk, or that are really high up there, you have to stop. Well, then you're going to have to do it. All right. And they have to, you're going to have to help them. But whatever the case, know that just the fact that they're doing therapy with you, they're doing mega vitamin therapy and a couple of therapies before they do the protocol with you, you're actually helping them either way. All right. At all levels. So say right now, if a person is ready and we need to make the protocol for them. Before we start, also remember that when you take one bad habit away, you need to put a good habit in its place. That's why it's really good for them to be with you a couple of times, so you can get them back on track at all levels, like, drinking their good water, their 1.5 liter, start walking, doing the gym. All right. All that plus the therapy helps increase their dopamine level. All right. And serotonin level. So then they're ready to get that bad habit out. All right. Because remember, as I said in the beginning, by taking the smoking out, they will be depleted of dopamine levels. So we need to put something else in its place. And what I tell people is, what are things that help increase dopamine is exercise, sex, okay, happy things, laughing, but usually movement. We need to get moving. All right. So by moving, we increase that dopamine level. Now, I'm going to tell you something that I've noticed the past year that I have been also working with Herbalife. Herbalife products also increase dopamine because they're full of vitamins, and they're full of vitamin B's, helping the neurological system. There's, even the tea helps increase serotonin. There's different ingredients in the tea, in the Formula One, and everything that help increase serotonin, help increase dopamine. And it has been noticed just by taking these products, people feel that they can do things because they have more energy. All right, so that's also some food for thought for you. I do introduce people that do want to change their way of life, stop smoking, etc., into Herbalife because it helps them. It helps them want to do new things. So if you want more information, get in touch with me and I'll let you know how we can work together with that. Now, a person has come to me, right? And I see that they're ready to stop smoking. So we set out a plan. The plan is this. We need to find 5 days that the first 3 days, I usually have Monday to Friday. I don't have the weekends in. All right. So I do Monday, Tuesday, Wednesday, Thursday, Friday. Those are the 5 days. And we find their schedule whereby Monday they have to come first thing in the morning. First thing in the morning. They have to come 2 times a day. Monday, Tuesday, and Wednesday is 2 times a day. Okay. Thursday and Friday is once. And the reason why it's 2 times Monday, Tuesday, and Wednesday is because these are the hardest days. It's the first 3 days because from day 1, Monday morning is going to be their last cigarette. And Monday's not going to be so difficult. Tuesday is going to be difficult. Tuesday is going to be very difficult. Okay. Wednesday morning is going to be difficult. Wednesday afternoon is not going to be difficult anymore. Okay. Their dopamine starts going up because we're doing two therapies a day, these 3 days. And then they're also doing the other things that you're telling them to do, drinking water, drinking their tea, doing their mega vitamin therapy, walking. All right. Then Thursday they come in once and Friday they come in once. So these are Monday, Tuesday, Wednesday is 6 therapies, 7, 8. And you have 2 more therapies because it's a package of 10 therapies. 3 days after, that's Saturday, Sunday, Monday. After Friday, Monday they come in. And then they come in the following Monday, a week afterwards. Now, if you wish, you can also do after 2 weeks, just a gift to them or, a follow-up. Make sure that they're on track. And, then they can stop doing the mega vitamin therapy and then you can give them a logical sequence of whatever vitamins they need. Okay, because they will need for at least 6 months. I take my vitamins for life, but they need a rotation. You need to follow them up. All right, follow-up is very important. Don't let them do whatever they want. Follow-up is very important. Okay, so that's the plan of action. All right, now, what do we do the first session? The first session that they come in on Monday morning, okay, usually I tell them, you are not going to smoke 2 hours. If your session with them is 8 in the morning, you can tell them at 6 a.m. is going to be your last cigarette. But you bring your package here. I need your package here. Okay, bring your package here. No cigarette 2 hours beforehand. So if they come at 8, the last cigarette is at 6. If they come at 10, the last cigarette will be at 8. Okay, so for 2 hours, they're going to be smoke-free. And there's a reason for this because the dopamine starts going down. And we want to measure how stressed they are. The device wants to see that. All right. And they come in already Monday morning. All right. And you go to the additional stop smoking. All right. Now, here, there are different movies, and you can go into the, as an advertisement for you, you can go, if you see a smoker and you want them to start smoking, look at these, you can tell them, look at these movies, and this is happening to you. So if you go to arteries, you can see what's happening with the arteries. Oh, okay. There's the eye. The lungs. So, you want to scare them because it is scary. And people don't realize what kind of damage they're doing to their body with all this, right? Lung. Let's look at the stroke. Huh. What is this kind of like? Let me do it one more time and see maybe. I don't know what happened with this movie. Let's go to the tar. Oh my God. Okay. Let's look at the tumor. Okay. So these videos are good for them to see, especially children and young children that really don't realize what they're actually doing to their bodies. Not only young children. I mean, I see so many people, even in their mid ages, that they're resistant. That will never happen to me, even though there's a sign stuck on the entire package that smoking kills you. Okay, they think that that will never happen to them. Anyways, so what do we do here? First off, we want to put the cigarette information here. So depending on um, what cigarette they use, we need to put the information here. If we don't know, because a lot of packages nowadays, they don't have the nicotine tar and cigarette and the nicotine and tar information on the package. They used to, but not anymore. Okay, so what you can do is go into the information here. This opens up a file. And if you go down, find the closest type to the type of smoke cigarettes that they use. Okay. Camel here. There's all sorts of brands here. All right. Marlboro. Where's the Marlboro? Malibu, Marlboro's here. So the tar is on the first column and the nicotine is the second. So if we go to Marlboro, let's say, okay, tar, let's say for Marlboro, is around 16 and 1.1 nicotine. 16 and 1.1 nicotine. Okay, 16 tar and 1.1 milligram of nicotine. Okay, and let's say they're doing 1 pack a day, 20. All right, so what we want to do is we first test them. Okay, as soon as we put the information here, we need to put the information here so the device knows and adjusts to their issue accordingly, because the testing adjusts the information that you're putting to them and their 2-hour gap that they haven't smoked, they didn't have a smoke, right? So you test them always with harness, okay? You want to have good results, so with harness. So let's do the test. It's patient should not smoke 2 hours before therapy, okay? And we're doing a testing. It's not 3 minutes. I think it's less than 3 minutes. I think it's a minute. The way it's going, it's a minute. All right, so patients should smoke 1 cigarette now. When finished, place the butt on the test plate and please click treat. So you take the harness off, you give them the one, they take the 1 cigarette from their package. Okay, and I take them out. I don't let anyone smoke in my office because even the smell for the next person is not nice. Okay, we should not smoke in the office area. Okay, so they go out and smoke. Puff, 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 and this is their last cigarette. Tell them this is your last cigarette. Enjoy it. All right, and that's that. They come back. They sit on the chair. They put the cigarette, as it says here, on the butt. They put the butt on the test tray. Not you. You don't want to touch it. They put it. You put the harness on them. Make sure you give them plenty of water. Okay, they need to start drinking water so they can detox. And here we go. So what we do here is we test stress, lung, and pharynx. And I'm not going to click it now because I'll be stuck in a therapy for 30 minutes. I do treat, and it's about 30 minutes, this one. All right? Tell them to relax, and you're doing them therapy. Now, as I said, we're doing a therapy in the morning and a therapy in the afternoon. And I usually, in the first day especially, and Tuesday, they are 2-hour sessions. Wednesday can be 1.5 and 1.5, whatever. But I usually tell them 2 hours. Why not? They're coming in, let's do the full package on them, because what this does, this is an amazing therapy. It's 10 therapies altogether, right? And it not only helps them stop smoking, and they've stopped smoking, but you are reversing everything one on top of the other. Okay, and you're putting them on another path, health-wise. It's amazing. It's just amazing. Okay, as long as they do it right. And explain to them, if you smoke even one cigarette during the daytime or tomorrow or whatever during these days, you have ruined the protocol. Even one therapy has ruined the protocol because they're taking baby steps to get better. If they do the one there, and you have to stress it, one cigarette, even one puff, will ruin the entire protocol. And this is why I tell them they have to prepay. They prepay me. They don't pay afterwards. They prepay me for the entire 10 sessions because it's psychological. It's their commitment to what they're doing. Okay. I've had people pay me at the end too. That was no problem too because I knew they were committed. But the thing is that if you don't know them, okay, make them commit from the beginning. Okay, and I do that package deal. So, another very important thing that I tell them is the afternoon of Monday, because it's a difficult day. Monday and Tuesdays are a difficult day. You need the 2 sessions kind of close. You're not going to have it one 8 o'clock in the morning and then another one 9 o'clock at nighttime. It's too many hours difference. And they are going to come to you with their nerves haywired. All right. If they come to you, I suggest on Monday, not 8 o'clock in the morning. I would suggest the first session to be 10 or 12 midday. All right. And then the second session on Monday, like at 6. So it's a 6-hour difference. All right. It's feasible. And you tell them, if you feel you need to come earlier, you call me and you come. Don't do that cigarette. I'm standby for you. They feel the comfort. They feel the love. You're standby for them. All right. That's why I have 2 and 3 devices in my office. Okay. For this reason, for the emergencies, I don't only have 1 device. Okay, if you're serious about your practice, you need a second device. Okay, for these situations, for the emergency situations, for your family. or whatever. So you're standby, right? So we have the first session and the second session. I'll tell you what we're going to be doing. On Tuesday, they can come at 8 first thing in the morning, the minute they wake up, because they're going to want their cigarette. And they usually have the coffee and the cigarette. That's another thing. If they have a habit of drinking coffee with their cigarette and no breakfast, the minute they get their coffee, they're gonna want that cigarette. So they need to change what they're drinking. That's why the tea is great. Give them something else. Okay. Tell them don't do the same habit. Okay. Start doing something else. That's why I'm telling you, Herbalife is great. So they just make their smoothie and they start their tea and they're fine, right? So if they come on Tuesday, like at 8 or 9 o'clock, first thing in the morning to you, you can serve them their tea. You do them their therapy. I'll tell you what you're going to be doing. The next session on Tuesday, again, should be around 6. Shouldn't be too late. Shouldn't be 8 or 9. It's too late, right? And you tell them, I'm standby, because Tuesday is a difficult day for them. All right, you're standby. Wednesday, they come in the morning. Wednesday, they're a little bit better. But Wednesday afternoon, a click is going to happen. And they are going to be better as long as they did not do that one puff. If they did a puff and they lied to you, you're going to see that they're not going to be good. They're lying to you. They've done the puffs. All right. And they think that it's okay. You're going to stop them from smoking. They are responsible. Okay. By Wednesday night, they should be better. And that's why you go Thursday once a day and Friday once a day. Should be better. And they're off. And they're also taking their vitamins. And they're also walking. And they're also eat plenty of liquids. And they're off. They've already done with you Monday, Tuesday, Wednesday, 6 therapies in 3 days. So that's the dopamine. All right. So each time you start with them, the first one on Monday, Tuesday, and Wednesday, you do the stop smoking in the morning for 30 minutes. Of course, they don't smoke though. They don't smoke here for the testing, and you do the treat. All right. And then very good therapies are the home use. Very good therapies. I do the home use. Okay. And basically you have to do all the mental, all the brain. All right. If they're having issues of insomnia, you do insomnia. If they're having issues of depression, do depression. It's okay. Attention deficit, definitely. People with addictions usually they're more prone. That's why we're doing their brain. Okay. Emotional trauma. That's what I said in the beginning. Like these kind of things do trigger addictions. Negative emotions. That's fear. Brain. Release mental superpower. All right. You can do an unconscious choice. Let's see what else. Give beauty. Why not? And what came up? Meditation. Sure. That's 12 minutes. So you can do a start, see which ones are not rectified, and start redoing until everything is rectified. All right. Very good programs. Why? Because they're nonstop. They're 12 minutes of full therapy without going here, there, and talking and everything. Okay, so you do your 30 minutes, your anti-smoking, another 15 minutes here. Then you can start doing brain wave training from here. From time therapy, working the brain. By working the brain, you're enhancing intellect, you're enhancing that brain activity, okay, and they're more in tune, you're clearing the mind. So you're going to start super learning, okay? You can do 3 minutes, 5 minutes, 10 minutes here. Okay, I'm just doing 1 minute on purpose. And of course, on piggyback, the endocrine, definitely, hypothalamus, the pineal, the pituitary, the thyroid, definitely. You'd want to do the brain, especially the frontal and the prefrontal cortex, okay? Do the entire brain, all right? The kidney, support the kidneys, support the lungs, support the lymph, support the immune system, all right? So 70, I would do it over and over again until the rectification of super learning is over 85. Then I would do the super learning AFE, go back to body viewer, psychological addiction, and let it there. And let it there. Okay? Let that run. Go to disease dictionary. Addiction. Where's the addiction? There. Okay. Start quick. You can add to therapy any piggyback that you may have downloaded from the Simplicity report. The piggybacks, you can download that, whatever they may need. Here says 21 minutes, long-term and treat. All right, have that running in the meantime. Go to iridology. Anatomy. Unconscious choice. The brain, right? Let that run. Okay? So you would wait till the rectification is over 100 and deepening, okay? And then you would end, close, and then go into the time treatments, take it to max, and do the stimulate intellect. Make them smarter. By making them smarter and increasing their IQ at all levels, that's emotional IQ, intellectual, mental IQ, everything at all levels, their intellect, you are helping them clear their mind and be more confident that they can do this. Okay, now you have 6 therapies with them. You're not going to be doing always the same thing. And have in mind, although you are going to be doing the brain as you go along during the days, like morning, night, and all that, you will see the rectifications come quicker. So maybe on Monday morning and Monday afternoon, you're not going to be able to do too much, but on Tuesday, the rectifications are going to be much easier. So you can have more time to do hormones. You're going to have more time to do the blood therapy. You're going to have more time to do emotional. Wednesday too, you're going to have more time because your rectifications are going to be better. Thursday, you're going to have more time because the rectifications of the brain are going to, in effect, be much quicker. So you're going to have more time to do other things. That's why I'm saying they're doing a gift, and I tell them this, they're doing a gift to themselves, not only by stopping the smoke, but by resetting their body. I mean, a lot of people come to me and they say, why should I do therapy with you if I could just stop smoking on my own? Yeah, well, you can stop smoking on your own. But the thing is that a lot of people who do stop smoking on their own either gain weight, have other autoimmune issues afterwards, or restart smoking within 3 to 6 months. That's the issue. Tell them. And that's the difference. You're doing a gift to yourselves by doing 10 sessions, okay, of therapy while also stop smoking. And they're resetting their body. It's amazing. Okay, so 97%, right? So after we've done the stimulate intellect, then we can do whatever the unconscious. I always follow the unconscious. Okay, here it says reverse line. We're going to do that. Skin aging and reverse lines is actually anti-aging. All right, so it's working the cells. All right, so you want that too. Maybe it's also working skin cancer. We don't know what it's working, but it's working something. And it's coming up for some reason. Okay, the aging. So, each time you're going to be putting something. You can also piggyback more metabolic, let's say your inflammation and degeneration. And you can add to therapy here and, put addiction here. Put the most stressed organ. What's their most stressed organ? Is it lungs, double space kidney? Okay. Psychological concern, maybe sadness, stress. All right. And load that. And then do these therapies. Okay. And basically, what's coming on? Deep detox. So we need deep detox. You're going to have time within these 10 sessions to do homotoxicology. Really important. Homotoxicology, as I've told you in previous lessons, is amazing because it not only detoxes from toxins, but it also detoxes from toxins from the emotional, and it's like a lift. It's like taking a weight off their shoulders. All right. So left spin is great. I'm negative, magnetic, great. I realize that I have stress, but I do have stress because I know there's a lot of things going on. And stress is my biggest issue here. Blocking sugar, resistance to change. I need to be more open to change. Okay. These are unconscious resistances, and resistance to change is a big chapter for addictions. The resistance that, sometimes it's fear. Resistance comes from fear, the fear of the unknown. So being in your comfort zone. Okay, I'm good in my stress. I'm good in my addiction. What if I can't do it? What if this and what if that? So having said that, something important to do, if there is resistance to change, and since we are working, you can't see my screen? Let me unshare and reshare. Let me see. Something maybe happened with the internet. Stop sharing and let's share again. How about now? Kevin, can you see my screen? Can you see it now? Okay, maybe it was just a glitch. Okay, so one important thing is if you go to the Organi field subspace here from the beginning, do this as well. From the beginning, you can say here, I am free from addictions. Okay, I am free from resistance to change. I am free from unconscious resistance to change. Okay, and put 528 hertz and 888. Spiritual harmony, and something really important also is before you do this, okay, in some of the sessions, like after the first day, or from Monday afternoon, let's say, or even from Monday morning, doing woodpecker. I've mentioned woodpecker before, especially in the technician course, but woodpecker is really good for overthinkers, for addictive thoughts, and getting a person, oops, put that 1 minute here, activate for 1 minute. Okay, and you do woodpecker for 1 minute, and then whatever you do thereon, it will help them be more open to your therapy. Woodpecker helps with hypnosis. It's the 10 hertz. They use this a lot in the 50s in the United States with the it was like a tick, 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 tick to help people, not create riots or, keep people at a level that's controllable. All right, so just 1 minute of woodpecker will help a person be then more open to whatever you're doing. So this is really good also for people who you're working with addictions. All right, so that they can be more open. And then you activate your Organi field, and you can then take this, copy it, Control C, close, and go here to your electrohypnosis. Right, and paste it there and activate electrohypnosis. Okay, so you can do this to them every time in the beginning as a startup. All right, and then you can put, let's say, 90 minutes here, and put it at piggyback. So electrohypnosis is running, Organi is running too. All right. 10 sessions is plenty in going through the entire program with them. All right, you're going to be doing mainly addictions and wherever you have addictions, okay, and brainwave training, but you're going to have time to do a little bit of everything. Okay, in NLP, obviously, you're going to do the addiction release. Okay, you're going to do the addiction release, which is the AFE. Do it till it's over 100. All right. Another very important one is the motivation stimulation, because you want them motivate. Motivation is dopamine, right? So you're motivating them to do new things in their life. So that that's another very, very important one. Now, alongside with cessation to smoking is the sugar cravings, right? That they will have. And they'll be scared of eating, right? Overeating. So you can do this too. And as I do suggest, that's another reason why I do suggest also Herbalife, because Herbalife helps with this too, because it helps regulate the sugar need. All right, because you're eating protein. Okay, so you do need to support them on this so that you have the best results with them, and they will bring you more people, because when you have results, you will have a good name and a good reputation, right? So, having said that, I've told you many times that one of my favorite programs is the covert. I do believe that you should also do covert a couple of times within those sessions with them. The covert helps unblock their stress. All right, so curiosity, sensuality, sexuality, manic, uncontrollable, focused mind, joy, fear, resistance to change. So here, socially, yeah. The curiosity of being liked, of feeling sensual and feeling beautiful. All right, and the personal secret, the sexuality. Okay, it's the hormones. All right, and sometimes getting out of control. That I don't want that to happen. Sometimes it does. Self-secret, being able to focus. Yeah, I do get off sometimes. And the lack of joy. But basically, though, is the fear and the resistance to change. All right, so helping a person unblock themselves, unblock them from the conflicts will help inevitably also with addictions. All right, so you do each one of them by itself, you bring them down here, you do the therapy. I have seen amazing results with the covert, and if you do it a couple of times, so it's 113, reset, and go to the next one. By doing it a couple of times, they'll start feeling that joy and feeling that the conflicts are not there anymore. Amazing. All right, 106, reset, and go to the next one. Oops. and then reset and go to the next one. All right. And then you do each one by one, right? And then you load everything after you've done each one by themselves, and you build the enlightenment. Remember? Yes, we go directly to test. Madalena, you don't have to do the other therapies because it does the therapy on its own. What you can do, because I do like, since you have 10 sessions with them, you can do the anti-smoking. I usually do the Monday, Tuesday, and Wednesday. I do the anti-smoking, and then I can do the startup, like I usually do the startup, from going to the universal therapies and doing the vagus nerve, because that lowers the need, okay, and lowers the stress level. So you can do that. You can even do Apollon and Aphrodite, because that also lowers the stress level. Okay, depending on your time, depending on your other things that you have to do at the same time, because sometimes they may come in earlier than expected and you may have another client. You can put them on Aphrodite and Apollon, and that works just as well. Okay, because they're already in the phase of treatment. The moment you do calibration with them, they're going to start feeling the therapy immediately. They're going to start relaxing just by being with you and just getting into the mood, even from calibration, especially after the third day. Okay, but yes, you can go directly in there, and you can then go into the universal therapies. All right. You can also go here and put addictions in your situation hold and see what else is going to come up for them that they may need. Let's see, sarcodal therapy. So I need sarcodal therapy. What's sarcodal therapy? You go into short sarcodes and you support the organs, or you go either through the short sarcodes, right? You can even check which sarcode therapy is needed. If you go into sarcodes here, what sarcodes are most for the nerve, the cranial nerve, tendons, cranial, and TMJ. So my cranial system for TMJ, the stress, that's coming up for me. In the 90 though, here's the vagus nerve. All right, so vagus pancreas is coming up as well. So, and the sinuses, etc. Ear. All right, so in the 90 numbers, I see a lot of cranial. I see the eye. I see the TMJ. I see the pancreas. Um, Whatever the case, I would uh, also work on here's small intestine also in the 90 numbers, and kidney, and of course I would work um, lungs, obviously, okay, kidneys, etc. So I would either work from short sarcodes. Okay, and okay, I could work on the face for all the muscles on the face since the cranial came up. I would work on the larynx for the smoking, the lungs, the lymph, right? The pancreas, since pancreas was also coming up. Sinus, I also saw coming up. Small intestine came up. So did stomach, all right? Somewhere I saw the ear as well, okay? Do the endocrine for hormones, all right? But you could also work sarcodes from the spinal. What I would do, first off, go to original sarcode list here and close, and then open the sarcode chart. See which ones have peaks. Which sarcodes have peaks? Mhm. Brow chakra, heart chakra, pituitary, heart, endocrine, immune, hypothalamus, immune, autonomic nervous, stomach to digestion, right? Saliva glands. So all these, you can do a top, treat whatever's over 100. Okay, I would do that. Um, then you can go to the timed therapies here and work the sarcodes from here, the ones that come in reds, and then whichever other ones came from the matrix. Okay, remember that you can also, let's see, the digestive, that takes the whole digestive system that was saying the pancreas, the intestine, the liver, all right, and see holistic organ health restore 6 minutes, all right? Say no, but you can put it here for 6 minutes. Opt for doing that. Don't say yes there. It's better to go from here to 6 minutes and then start and then redo the holistic health restore. Immune stem, how many minutes? 11 minutes, even more. So then you can put it at 11 minutes, right? And so forth. Now, something else that's also very important, because remember what I said about the shaping function, and it's for difficult clients. You put the shaping functions down to at least 50 instead of 85. Because having a person quit smoking is a difficult client by definition. All right, so you want them to have the reward not only at 85 but at 50, even at 35. All right, even at 30. Okay, have them have the reward each time you press that button, so they have the dopamine reward. And what you'd want to do is put dopamine up here, taurine definitely for energy, because they're going to be at a loss of energy, oxytocin to love themselves, serotonin, all those feel good hormones. And growth hormone was the growth hormone. GABA definitely for thought. all hypothalamic hormones for homeostasis, and the growth hormone. Okay, so you disengage and engage, so you're engaged there. I would also, Control C, do a little bit of hormone streaming here with the hormones that you have put. Start hormone streaming for 1 minute. You can even start from here and then go into the anti-smoking. Remember, shaping function is open even before testing. It's open after calibration. You can go into the shaping function. So you can start by, after their first session, not from Monday morning, but from Monday night, go in here. Or you can go from after this stop smoking here and then do it, because you want to first test them. You want to have their stress level first off on Monday morning. All right. Thereon, after it, it's fine. You just start working on that. Okay. But you want that stress level, and you want to know, because it self-adjusts, and it's because they haven't smoked for 2 hours. You want the testing on how they feel at that moment. All right. Because the device will self-adjust to them. Okay. But from there on, it's okay, because they're already stressed. So you can start with this and then go into the cessation to smoke, no problem. Okay. The cigarette that you give them on Monday morning to smoke, the last one that you put it on, from there on, you don't need to have the butt anymore. You throw it away, and that's that. Okay, from there on. And but the first time you need it, because it's taking in that element, so they can desensitize themselves from it, that they don't want it anymore. Okay. Something else that you can do that will help them, all right, the first day that they come in, have them have their bottle of water on the test tray, even every day that they come in. Okay, have them bring a bottle of water, put it on the test tray, and go into the homeopathics. Now, take that list, and you can, let's pull it down and find tobacco. I'm searching for lobelia. Lobelia. Okay, lobelia is great for, there it is. It's great for anti-smoking. So see which one they need most. Double click it, see, check potency. All right, and zap and duplicate, so you can load lobelia in their water and have them drink that water. So it's an extra added remedy during the daytime to help them with the addiction. All right, zap and duplicate and treat till 95%. So you're sending it through the harness, but you're also sending it to their water bottle. All right. So that's something else that you can put an add-on to your therapy. All right. Other things that we can do during those 10 therapies is go here, put addiction, find it in the matrix, find what's coming up. So see, it's coming up a lobelia and this one, the inflation. So we can do like a treatment here and send this lobelia also to the water bottle. Remember, anything that you're doing, it's being sent to the water bottle. Okay, even this one too, this homeopathic. All right. So even Nux vomica is coming up. Interesting. All right. So depending on what's coming up, you can also either do a little cocktail here. Now, let me show you. Let me do a little treat here so I can open up my Matrix Explorer. I've showed you this before, but just as a reminder, because we all do tend to forget, Matrix Explorer, a little trick I have. So with the Matrix Explorer, because you can't do it from the Matrix directly, what I want to show you is the cue. So put addiction here and search. So what you can do is, I want to get a couple of these homeopathic remedies here in Q, right? The nicotinum tabacum, the dopamine, not the dopamine. Anyways, it's okay that I put dopamine. The lobelia. I have two types of lobelias here, and the Nux vomica. This one too, and this. Okay, so I have these in Q. So if you go back here in the main matrix and go to Q, you have these items and you can do a zap from filter. Where's the zap from filter? Here, 5 minutes zap from filter, and it will do 5 minutes of all of these. All right. So you're loading it in your Didn't I do testing? I wonder why my second wave generator isn't working. Okay, so I'm in a 5-minute therapy and it's doing the top. items I need, type top items that I chose as homeopathic remedies for me, okay, as a cocktail. Just 45 seconds to go. Sorry. I have some notes on the anti-smoking. Just okay. So, um, some insights for habits of smokers. Um, some because smoking. So one of the difficult things with smoking is that it involves not only the addictive of the nicotine, but other factors like the smell, the taste, the fact that they're holding something, right? So you need to reduce the stress around that too. So some ways that you can help them reduce, let's say, holding something. They can buy like a small little object, like they can play with their pen. Okay, tell them to play with their pen in, instead of trying to hold a cigarette. Tell them to hold something. Get a stress ball, something so that they can have in their hand. So, let me give you an example. I've seen, uh, you know, uh, pet pet owners, like dog owners, right? They further walk so that their dog doesn't bite people. They don't bite people. They put a ball, they make them hold something in their mouth. So they feel they reduce their stress, dog stress. So that way they don't bite anybody. I've seen that too. So it's the same kind of thing that we need to do with humans too. So, instead of holding a cigarette, tell them to hold something else to help with that fidgetiness, okay, and reduce their stress there. Or like, tapping. They want to do something with their fingers, like tap. I've seen cigarette smokers tap a lot. All right, so they don't smoke. Remember in the beginning, I said, for people, in order to prepare themselves for the anti-smoking protocol, start with, until you get to them, your favorites cigarettes. And your favorite cigarettes is usually with coffee, after a meal, after sex, after work, before bedtime. So they need to change their routine habits. Okay. So other habits instead of that is like chewing gum or snacking. Okay. Now, snacking is dangerous because they can increase in weight, right? So they need to be careful on what they snack on and how much they snack on. Like, they can snack on, let's say, cucumber or carrots, all right? So that, it feels like carrot sticks. So that feels like it's a cigarette, but it's not, right? And they're chewing something. So that's a good idea too. And it gives them vitamins at the same time. And cucumbers also help with, hydration. But that's another thing why a water bottle is really good, because they're also holding it, they're drinking. And so they're replenishing, they're doing something with their mouth, they're holding on something so they can fidget with that. So that reduces that stress too. All right, something that's also very important. For them, they should tell their friends and their environment that they are stopped. They're going into cessation of smoking. This is very important for their loved ones to know and their friends to know. I always tell my clients that if a friend tells you, hey, come on, take a cigarette, one won't hurt, that friend is either jealous or, they definitely are not a friend. Okay, and remember that. I tell them this, okay, because they have to be aware that if a friend tells them, come on, take a cigarette, it's okay, one won't hurt, it's a friend that doesn't respect your decision or your, effort in doing something good for your life. All right. And they have to be aware of this. So you're there to help them and make them aware of this. And they have to be aware of the people in their environment that are not good. Those are toxic people. Okay. And what I tell them also, because I've seen, this is so stupid. I mean, really, I tell people, look, especially the first 3 days, but this week, I do not want you interacting with people that smoke. I don't want you in cafes where they smoke. I don't want you in bars that smoke. Just 1 week. After the week, it'll be okay. It'll be better. But this week is very difficult. This is your first change. And if you're put in an environment that triggers you're making it more difficult for yourself. Now, I've heard people tell me, you know what? I went there yesterday and I wanted to test myself. You're going through this and you want to test yourself. You're not ready to test yourself in the first week. They actually went well. Okay, but why put yourself in such a situation? They went well because when you're doing therapies on them and you're helping them, they will go well. But why put themselves in such a situation? It doesn't make sense. All right, for 1 week, help them and try to motivate them to try to change friends, because being with friends that smoke, or why don't they, I always tell them this, that why don't you help your friends stop smoking? Why should they influence you and you don't influence them? Okay, for something better. Influence them, start walking, make a walking group, do things that are good for you. Healthy alternatives. Okay. Something that they may have, and that's why we're doing those first 3 days that are, 2 times a day, and then the other ones that are 1 time a day, is to avoid withdrawal syndrome. Okay, because the withdrawal syndrome can be headaches, fatigue, insomnia, increased appetite, weight gain, digestive issues, dizziness, lightheadedness, irritability, mood swings, cravings, anxiety, even coughing, sore throat, because they're detoxing, skin changes. These are the first changes that they may see. But the thing is that we are reducing these stress reactions, all right, and we're helping them. I have noticed people that do cough within the first 3 days because they're taking it out, and then they're cleaning out. Of course, with these therapies, I also do detox, foot detox balm, and that is amazing with our therapy as well. So doing that for the first 5 days, detox as well, they in a week, they're brand new. And I do suggest take a picture of them the first day they come, the second day they come, and the last day they come. Okay, there's going to be a change. There's going to be a huge change, even in their skin and in their face and everything. Okay. Now, it has been noted that one second. It has been noted that people that stop smoking after 3 months, after 6 months, after 9 months, after a year, after 3 years, for some reason it's a threes. Okay, for some reason, that's what statistics say. They start smoking again. What I tell them is, because you cannot be responsible for that, because it's the external triggers, and you have to tell them that. Tell them this is the statistics, and what I need from you is your responsibility, that you will call me the moment you have that urge to smoke. Because if you do that, the one cigarette will become a pack within a week, because the cell has memory and the brain has memory. All right. So you tell them before you finish with the 10-day thing that if at some point something happens because things happen in life. Unfortunately, we may lose somebody, we may separate, we may have a sad situation, we have a stressful situation, whatever, a sickness. And these stressful situations trigger the memory. And that one cigarette that they will take will become a package within no time. All right, so explain it to them that they need to come to you urgently before they do that one cigarette, if they feel the urge. So, brain areas that are very important to work for addictions in the short start codes. Brain. First of all, is the amygdala. The amygdala is where memory is stored. So here's traumatic memory. Okay. What happened? Oh, yeah. Traumatic memory or whatever. Okay, so you would do the amygdala. You would want to do the prefrontal cortex. So the frontal lobe in its entirety. The midbrain is very important. So the midbrain here is where the hippocampus memory, it's the midbrain, hypothalamus here. It's that area where dopamine, the hippocampus is also very important because new memories are formed with the hippocampus. So we want new memories forming with hippocampus. The basal ganglia is also very important. Okay, because this is what, when there's stress, the basal ganglia is where behaviors and addictive behaviors start. So the basal ganglia is very important so that new habits are formed. All right. The hippocampus and the amygdala, as I said, are for stress responses, anxiety, and old trauma. Now, another place that's very important is going into the athletes program. Going into the athletes program, you're working hormones at its full, all right? And dopamine. First off, you want to see what's going on, what conflict is most prominent on them. For me, it's the game of life and the team. Okay, that's the most stressed. It's self is clicked, but it's not high. All right, so I would do self because you do need to find yourself too and stand on your own 2 feet. All right, but my highest for me is the game and the team. So the game is the game of life and the team is your family. environment or your associates that's most stressing. So you're doing these AFEs. Now, do a STEM mental visual imagery, and this little hidden image will appear. You need to do all of them. Click on all of them because it works on all parts of the brain. But very important is the memory, to create new memory and new habits. All right. So these are AFE programs, right? So you would do the memory because it will work that part of the brain to help with old memory and create new memory. All right. Close. The willpower. Willpower increases dopamine. So you'd want to do the willpower. All right. Until it goes over 100. Stability, so they can stand on their own 2 feet, and the focus ability for them to focus. All right. Something else that's also very important is the warrior stim. Warrior stim makes them a warrior. Takes a minute. Make them a warrior. Make them strong. Make them confident that they can do it. Okay? Because a lot of times they have fear that they won't be successful. So why do it? Why go into the process? That a lot of people, even that are overweight and they're addicted to food, feel that, well, I can never go into a diet. I will never lose weight. I love food too much. I won't be successful. I'm in my comfort zone. Make them a warrior. They can do it for their health. So what happens is when for warrior, you do not have a percentage rectification, but it shows where they are in the zone. We want the bar to be in the zone, that's in the center, okay, balanced. We're not in the zone. If you do this a couple of times and you see that you don't get in the zone, you need to go do brain. Do brain and then come back here. Okay? Do the brain in the home use, like I showed you. Do the brain in the timed super learning therapies, like I showed you. Okay, if you have any questions, tell me. Yeah. Just because I showed you doesn't mean you will remember too. Because this is just a plethora of information coming your way. So, ask me so for me to repeat or whatever. All right, so now I went to the other side, but still off the zone, right? So, you do it again and again till you get in the zone. And if you see you can't, go to brain and come back. Even coordination helps. Let's do a coordination 1 minute and we'll do a warrior stim. Coordination and mind and body focus also helps. All right, so I did the coordination. Let's do the warrior stim to see if we got in the zone. Okay, so you go back and forth trying to get into the zone. Make them a warrior. Fear is also another factor involved with addictions. Okay, so we need to work phobias, because phobias also have to do with past trauma and the unconscious reactivity. Gloria had beautiful questions. I'm going to go to her questions. Yeah, good question, Gloria. The 5-day treatment is always done in person, I suggest. It's very important. Subspace therapy works, and we all know it works, but it takes time. Now, I do suggest in person with the harness. Okay. I do, if they're the last client in, I may leave them all night as well to help them more, especially the first few days. Okay. Because remember, the addictions are difficult. Okay, so we got closer to the zone. So you see how we worked? Phobias. Let's go to the phobias. Unconscious search. Let's see the story that's going to come up. Personally, I tell certain people of subspace spiritual work that may need it more or that are far away. Okay. I do charge for the subspace, but I don't tell everybody. Because if you start telling everybody, you're going to need 20 devices. Who are you going to put it? I mean, all right, and you do have to charge as well for your subspace work. So, Okay, so fear of love. Being scared of falling in love or emotions, this one, fear of cotton balls, plastic forms, or that sound. Thanatophobia, fear of death, okay, and fear of driving. A phobia affects personal and work life. Yeah, so, depending on what fear, all fears in themselves are fear of death, right? The root of all fear is the fear of death, right? So it's good that came up. And unblocking them and helping them get over their fear, even phobophobia, fear of fear, this helps with it, especially anxiety attacks. But ask them, even people who can't sleep at night, insomnia, fear of sleep, hypnophobia, right? Or nyctophobia, night, here. Or, depending on what comes up. Okay, these are also very important. And when you do the phobias, after you get rectification for all of these over 85, very important to go to an LP. You know, by doing a therapy, it's very important to do, uh, to close the therapy and do, uh, how do I call it? The full set of programs attached to those. Like, for instance, when you do the phobia, you need to come here, go to long-term therapy, and go here down to phobias, treat fear and phobia. Okay, this will lock in the therapy. And then after this one, you're going to go also into the biofeedback systemic relaxation. There's 2 phobias here, that you need to do as well. Okay, and that will complete the therapy on phobia. Very important. Okay, yeah, that's the word I was looking for, complete. You need to complete it. Okay, otherwise it's like doing half. It's like taking half a dipon or half a pill. Okay, you need to do the whole entirety to do a proper therapy on phobias, let's say. So the first phobia is here under relaxation, release phobias. And then there's an additional phobia that goes even deeper. Where is it? Release phobias. Okay, so there's 2 release phobias, one under relaxation and one under additional, which goes even deeper. Okay? The same for unconscious reactivity. You're not going to go into unconscious reactivity if you're at the end of your therapy and only have 15 minutes. You need an hour after unconscious reactivity to make sure that you have completed them and not brought up past trauma and left them dangling. Okay? So when you do unconscious reactivity, make sure you have an hour in front of you to properly take away that stress, take away the past trauma that you brought up from in the internal memory, and you've helped them release it. Okay, and you also tell them that the next 2 or 3 days you will be a little emotional. It's what I have done to you, but it's because it's coming up from past memory that it's buried inside you, it's come up to leave, and it'll just last for 2 or 3 days. But you do need to have the time to work on this so you don't leave them with a past trauma dangling, okay, and having them in a difficult situation. But you do need to tell them that, you may be a little bit emotional in this next. If they know what to expect, they know it's from the therapy, then they'll be okay. Otherwise, they may call you really upset. Okay, but if they know it's just a passing thing, then that's okay. Okay, so what do we do after the unconscious? Say if I do the unconscious choice, I put myself on, right? And I want to start. Okay, let's see what's going to come up for me. I'll tell you what we need to do after this. Okay, so inner spirit and with my mother, muscle memory and mental memory. My client is thirsty and forgiveness of God is necessary. All right, so childhood 6, 15, 14, 15, that was my difficult ages, 32 and 43. Stress, etc., stomach. So disease type, I would say endocrine. All right, and let's go to disease path. Now, usually, just by this only the top comes up. Anyways, because it came up disease path. But I'm just doing it also as an extra. So more ages came up, and we do a treat. All right, but it's just not enough just to do a treat, because right now I've brought up memory from these past times that may make me sensitive these days. Okay, so what I will need to do is reduce that stress. And let me show you how. So this is like, if you decide to do this therapy at some point, you're not going to do it from day one, right? You're going to do it, let's say, midway. And I don't suggest to do it during the 5-day protocol, because they're already going through difficulties. You can do it later on. Okay, don't do this from the beginning where they're already going through a change. Okay. So you don't want to put a lot of things on their table. They're already going through their difficulty of taking the cigarette out of their lives. So you don't want to put this on the table for them too. I'm just showing you that later on, after the 10-day period, maybe you can, help them with this as well. Why not? Close. You would go here. First off, you want to dissipate karma. Okay? Karma helps with going over, past trauma, forgiving themselves, forgiving others. So you would want to go into deepening with this. After this, you would want to go into the start biofeedback. And you would go into, first off, release karma. Okay, so you want to release karma from the biofeedback systemic relaxation, right? And after you do release karma, you would want to go into the relaxation and go into reprogram karma. Okay, this is amazing, right? So we are creating a new karma. We're releasing the old. All right. During your 5-day protocol, while you're working with these people of creating new habits, what I suggest is not do the unconscious reactivity, but just do the release karma and reprogram karma. So they have new karma. Okay. And that also helps release. Okay. And it doesn't bring up the past memory so much of past trauma, but it just releases. Just release and reprogram. Okay. So you can do this. You can do the release and reprogram during those 5 days, one at one point, not every day. Every day you can do the other therapies, though. The covert is amazing. Motivation, amazing. Aphrodite, brain training. Okay, but you can do this at some point as well, so they can also, help them with the new habits that you want. All right. I always love to do the unconscious choices. Do not fear the unconscious choice, no matter how strange it may seem to you that some things may come up. They're not. Like, look, stabilized sensory disorders. Interesting. For anti-smoking, it's amazing. I mean, sensory disorders, right? Taste, smell, touch, right? Stabilize those. Helps. Fibrosis disorder, yes, because smoking creates fibrosis disorders and unconscious interaction. Whatever's going on under your unconscious. How about the biofeedback unconscious choice? Let's see what's coming up and how that would go on with the addiction, polarity balance, and geopathic stress. Okay. For some reason, I always respect the device. Remote viewing. Your extrasensory perception, your inner feeling. Remote viewing. Interesting. Treat excess meridian dryness. Yeah, because, you know what? Let me go back a little bit. For the polarity balance and the remote viewing, there's a story being told here, because people who smoke and people who have addictions have, like, their intuition, their conductivity, everything is at a low vibrational level. Okay, so this will pick them up. All right. Treat excess meridian dryness, the dryness from the smoking. Interesting. All right. Let's go to the superpower. What is going to come up? Beauty perception. There we go. Seeing things more beautiful. Seeing things on the bright side. All right. Sun gazing, more vitamin D. Very therapeutic. Synesthesia. Okay. Helping them feel others too. I've noticed, I hate to say this, but I mean, this is something I've noticed because I'm not a smoker and smoking does bother me, but usually smokers don't really feel, they feel their own need. They don't feel the other's needs, and that it may bother another person. Okay, so that must be also worked on. Okay. So go with what also comes. If you don't know what to do, just do the unconscious. The unconscious knows, the mental plane, yeah, polymorphic, and the environmental connection. Okay, you being connected to the planet and environmental connection. Interesting. Okay, so that helps you connect with the universe. So good things can happen. Interesting. So I want to look over the questions that Gloria sent us. She sent us really nice questions. And as I said, I love questions because it helps all of us, think a little further. Okay, because situations, different clientele, give us insight. So, she treated a man who had emotional reactions, like, the desire to scream, cry, have distress, and also some physical prickling, like, in the chest after releasing cellular memories, like covert through pattern, even covert and trauma. This is normal, especially if you do zap emotional and traumas, and especially and she's asking, could I prevent it, or are these feelings part of unlocking patterns in cellular memory? Should I have warned him? Yes. Usually when we do the unconscious reactivities, what I said before, when you do the unconscious reactivity, that is when you do need to do and warn them that you may have certain sensations in the next few days, even crying, etc. But that's why it's important for you to have at least an hour after this to do other things to help them make it easier. All right. So when you do this, do the karma, like I said, and the covert. The covert on itself should not bring these sensations that you mentioned, Gloria, by itself. The unconscious reactivity would, but the covert helps dissolve conflict. It helps them relax. So it's good to do the covert after you do the unconscious reactivity. And you do it in such a way that you do one by one, and then you do them all with the mental power, and you leave it at least 15 minutes. And then after that, you can do the beauty perception. All right. And make them feel happy. You can do motivation that makes them feel good. Even also the beauty enhancement, make them feel beautiful, because making them feel beautiful will help them, increase serotonin, etc. All right. Feel good therapies. Help them do feel good therapies, and then do their brain. Okay. And make sure you do your startup, so that before you do all this, so that the startup with a vagus nervous system, it helps reset them. Okay. Something else that's really good to do is going either into the Aphrodite and Apollon, and going to the essences of beauty, and put, either self-love or harmony or joy. Okay. 4 minutes of joy. Okay. Yeah, maybe the man that you did this on, did you, Gloria, ever work on him before, or you dived into these things from the first time? I normally don't go into these type of therapies the first time I see a person. Okay. Because these therapies are, how do you call it? They're deep therapies. Okay. And a person needs to start getting accustomed to these therapies. So you're going to have to work on other type of, the basics, sacral, essences of joy, light therapies, the startup, first or second therapy, and then after the third therapy, go into these type of therapies. Get them accustomed slowly. Now, her second question is spring fatigue. Is it about emotions, or is it an unavoidable situation? Well, this has to do with the seasons, and some people are very sensitive to the change of season, and they do get fatigue with the change in weather. It's not an unavoidable situation. No, it has to do with the hormones and their sensitivity to hormones and their sensitivity to environmental change. So, we can work on that. Okay. Just like we, here in the environmental change, what came up here? Their connection, environmental connection, or in the start biofeedback here, for spring fatigue and seasonal changes that people are, even the geopathic stress has to do with seasonal changes. All right. So their polarity. Okay. With the seasonal changes. Even the body to soul, a connection to themselves. All right. Something also that's very important, uh, even for addictions, for conflict within themselves, right? And but also with this example that you mentioned here, Gloria, for people that get disconnected with the changes in their environment, is connecting themselves here. Let's go to the biorhythm and connecting, double clicking on the how do you call it? The sign, that the green sign that's turning around, getting this hidden panel out, putting themselves in. So Malvina with Malvina, right? And putting my birth date. All right. And calculating compatibility and fusing together and start. So fusing ourselves, this is very important also for addictions, to start loving ourselves. Okay. So look, my emotional bond with me is only 66%. My mental bond, I don't think of myself, 49%. I don't even have a spiritual bond with myself. Physically, I'm okay. Intellectually, I'm okay, but I'm kind of disconnected. I don't think about myself. I'm always thinking about other things, but not myself, right? So we need to think about ourselves. We're very important. We need to take care of ourselves. So what we do is we do start until all the numbers, are over 85. So let's do one more. And after doing that, try to opt with finding oxytocin. Now, I would do a Q with oxytocin, serotonin, etc. But now you can only do one Q, right? So let's find oxytocin. Oxytocin. All right, and I would do a 3-minute on a oxytocin. Zap 3 minutes on an oxytocin. After I connect me with myself, oxytocin, so I can bond with myself and lock it in. So remember, when how you layer in your therapy, just don't do this, that, and whatever, right? Layer in your therapy so there's a logical sequence. So I connected myself, right? And then I do the oxytocin so I can bond with myself and start loving myself. Then after that, I can go into the reduced conflict. And I can go to the NLP and the superpower and perception and loving myself there. So building the therapy as a logical sequence. All right. Very important how you build your therapy, not going from here to there. Because if you build it correctly, they will not have crisis therapy. That what you were describing, Gloria, is a person having crisis therapy. You don't want a person with crisis therapy because they don't feel comfortable. Okay. At least this way you minimize the crisis therapy. With 2 or 3 days, they may feel a little strange, but then they'll feel a lot better because it comes up, in, and out. All right. But you need to do these steps so that they don't have the crisis therapy. So Gloria has another woman that she's treated who has pain in the pelvic area. And she wanted to know to see if it was a muscle issue, if it was a visceral issue, or an old surgery for from a hernia. Okay, so she checked everything in a matrix, the risk profile, the homotoxicology, and she saw that it was mostly muscular, but the risk profile also said infection. So I recommended her to go to the doctor for an ultrasound. Okay, well, infection can mean when we look at the risk profile, we need to see the story behind it. The story is not only the top issue, but also what's surrounding it. So, for instance, for me, I see bone up here, but it's also connected to the kidney and the liver issues and also vitamin deficiency. This is a story being told. So, we need to see what else was next to the infection. Was the infection next to, was there blood? Was there digestion infection? Was there kidney infection? What was there parasites? What was next to the infection so we can know and understand? All right, and remember this is a risk, meaning that if infection was there, means she has a low immune system. And maybe there was some kind of infection causing the inflammation and pain. All right, so and around the pelvic area can mean kidney, can mean intestines. Maybe she has constipation and there's infection going on around there. We need to look into deeper. I don't have the full picture. Okay. And the fact that she did do a surgery for hernia. We need to see a little deeper. And what did the doctor say with the ultrasound? What happened after that? So she has another case, a 21-year-old young and healthy boy without any special disease, but he had insomnia. And it came up 2 times, degeneration in the explore risk here. Degeneration 2 times. Wow. I did the degen scan and cancer equivalent disease after treating and balancing him. What is the strategy for prevention with nucleus? Well, first of all, okay, insomnia and sleeping in general is one of the pillars of good health. Remember what we always say, that a house, usually for a house to be standing, we need 4 pillars, right? 4 or 5 pillars for a house to stand. If one is cracked, and cracked means not working well, in the first earthquake that comes up, the house may fall. Meaning what? If our body is the house and our body is the house of our spirit, right? And if we don't have the correct pillars, which one of them is sleeping, 7 to 8 hours of sleep, the pillar cracks. So whatever is in the top risk is an issue, is just around the corner. It doesn't mean that I have infection now, but it's just around the corner. So, and a degeneration. And we also have to see where we are in the cellular bar. Like I'm in an adaptation phase, meaning that I am used to having my pains. I'm used to being in the situation I'm in, and I don't feel pain. That's not good either. We all need to be in alarm phase so that our body feels pain when it's supposed to be in pain. But the thing is that being in exhaustion phase is the worst, because that is when we are at risk for everything. So I don't have all the information from you, Gloria. I need to know also where this person is in their cellular bar. Meaning, since this boy is not sleeping correctly, the 21-year-old young healthy boy, and degeneration is coming up, it means that if he continues this way without sleeping, it's good that he came, because it's not good. I have noticed people who do not sleep well, heart attack comes up, stroke comes up, and all sorts of bad things come up if a person does not sleep. And usually we see these type of things for at least 10 days after they haven't slept well. So we have to work on his sleeping issues to rectify this, not only on the degeneration, but we need to work on the sleeping, because it's one of the pillars. The other pillars are hydration, good nutrition, exercise, and no stress. There's 5 pillars of good health. Okay? So, the other question that Gloria had is a very good question for today's class on addictions. If a person is trapped, a man or a woman is trapped in love with the wrong person, a romantic vision and realistic relationship, yes, that is also addiction. Of course, you don't do, it's interesting. I mean, why not do the 5-day program also on these type of situations? I haven't done it, but I definitely think that for a person who is struggling in relationships, I think it would do wonders. All right, especially if they're addicted, and they have rejection and unrequited love, not receiving the love that they want to receive, or being with the wrong person. Yes, being addicted to people is very difficult, and we work the same way: brain, motivation, beauty, loving themselves, increasing the love for themselves, and covert, definitely. We work the same way. We work with addictions, work with the brain, work with the past traumas and the phobias of abandonment, because some people, and the resistance to change, because people who stay with the wrong people, and they usually know deep inside that they are the wrong people, but they feel safe with that person because they don't want to be alone. They're scared to be alone. So it's working deep with these phobias, and they need a lot of support. Once a month is not enough for these people. We need, if they're with the wrong people and you need to support them. Now, having said that, I wanted to give you one example of a person that I had. He didn't want to stop smoking. He came to me because his mother sent him. His mother was telling me, I want you to stop him from smoking, but don't tell him that you're going to do it, because he won't come to you then. This is what the mother said, right? And, so every time he would come, I said, what do you want to do? He would come once a month. That was it. And after about a year, he came to me that following month, and he says, I don't know what you did to me. Every time, once a month, I would be doing something on addictions, and it just helping him, motivation and brainwave training and all that stuff. After a year, he came to me and he said, I don't know what you did, but you stopped me from smoking. And I feel great. And, I started laughing. And he says, yeah, I know you did something, but, I'm happy you did it without me realizing it. But we did it slowly, slowly, slowly. And it just did the trick, the click in a year. You just never know. Okay. Okay, so Gloria says, with that person that had a crisis therapy, she'd worked on him before and he always felt good at the end, but this time he had crisis therapy. Well, it's like peeling the onion. You peel the onion and maybe you came to the core and that's why he felt it. It's okay. Explain to him, yes, this could be. This could be, and it needed to be done for it to come up and out. You were ready, and you were ready for it to happen. It's okay. Just continue what you're doing, and the next times will be a lot better. In fact, you're right. I had one woman that was just like that. She always felt good, and one time she just didn't feel good. And then she came the next time. She says, I'm actually scared because I'm scared that I'm going to feel what happened the last time. And I said, it's not going to happen. And it didn't happen again. It's just that it hit something that came up and out that needed to come out. And that was it. So I think I answered all the questions. I don't know if you have any more questions. I'll be happy to answer questions. I am. I think I went over everything I needed to do for the addiction. Tomorrow, let's see what the schedule is for tomorrow morning. Tomorrow morning, what's this? We have Sunday, spiritual training on intentions, past life, entering, biorhythms and planet analysis. Great. So tomorrow morning, 9 a.m. I'm going to have my tea and my liftoff. I'll see you tomorrow morning. Okay. If you have any questions by that time, feel free and I'll go over whatever, maybe you thought of. I'll be happy to. Okay. So see you tomorrow. Bye-bye.